I can testify to your explanation because we do see a lot of well-woman patients in our clinic, and their candida infections resolve within 7 days or 5 days, as short as 7 days or 5 days. And we have most of those patients have these candida problems for 5, 10, 20 years, some even 15 years. That they have never had a dry season before. They explain to us that they can have recovery within 5 to 7 days, some longer within 1 month. Their problem previously was solved, and they were very thankful for that. But I just want to also ask you a question regarding the antibacterial properties that you're talking about here, bio-strath. It is very useful for these Pseudomonas aeruginosa you mentioned, and it's also Staphylococcus aureus.
Yeah.
And do you have any experience in using bio-strath, the liquid or the drops or the tablet, whether you crush it or whatever it is, for chronic wound management? Certain wound doesn't close, okay? And we do dressing on them each and every day, like diabetic foot or sacral kind of, you know, the area where you have a pressure sores, bed sores. So every time you do the nursing dressings and all these things, do you have any experience using bio-strath products topically in the skins and for the antibacterial purposes or healing wounds? Thank you.
Dr. Strathmeyer in Germany, he manufactured ointment for topical use of herbal yeast, and this worked quite good. But we never took it over in Switzerland. We never did it. And we had patients who used this topically, but I always said it is difficult because it is a syrup with a high viscosity, and I never used it topically. I drink it from the bottle, but I never used it topically. I don't know, this we would need experience from a clinician, how honey, malt and orange juice can be put, because the cream Strathmeyer had was without honey, malt and orange juice. This was the herbal yeast in an ointment base. But this is a question.
Because it is very common for people physicians to use honey, you know,
honey
without diluting them on the chronic wounds.
Yeah.
So viscosity wise, you know, honey is also
honey is used, yes.
Still, yeah.
This
I suppose, that's why I'm asking.
This would be interesting to have a look at.
Do you have any physician reporting this?
No. No, we need you to do it, and then you tell us. Alex gives you bottle, and then you try on patients.
Want to be the first one, whether it is practiced.
No, we have not. We had this ointment, but we are not a company manufacturing ointment, so it was difficult to take it over, and then you are in this borderline of cosmetic and medicine, and you have to register, and it's a lot of points.